Hello, I'm Kerry Bull and I'm pleased to present this research snapshot on behalf of professionals and researchers in early childhood intervention, more commonly known as PRACY. Thank you to Paula Buttigieg who prepared the material for this snapshot. Today I'm here on Dja Dja Wurrung country and I acknowledge the traditional custodians and pay my respect to elders past, present and emerging. Today, we're discussing the article Improving Attachment Security in Early Childhood Intervention, a framework from constructivist grounded theory by Alexander, Frederico and Long. I'll briefly talk through the article and then share some practical ideas about how to translate the research findings into practice. Attachment security is an important but neglected area of practice and research, and PROCY chose this article for several reasons. First, we understand that the development of secure attachment between a child and their parent, within which a child has confidence that their parent will be available, protective and comforting, is positively associated with communication, pro-social behaviour, self-regulation, social skills and resilience. Secure attachment is critically involved in the initiation of complex developmental pathways and has lasting effects. Second, there doesn't appear to be other literature available about how early intervention professionals can improve the attachment security of children with developmental disability. So this paper provides us with a comprehensive discussion and an appealing framework. And finally, this article was selected because it's been conducted by Australian researchers. The first author, Stacey Alexander, has been a psychologist working in the field of early intervention in Victoria for many years. Stacey recently completed her doctoral studies on attachment security and has published several papers about the topic, including this 2022 article that we're discussing today. It's great to see this relationship between research and practice. Secure parent-child attachment is conducive to the aims of early childhood intervention, which are to enhance the development, well-being and participation of children with developmental delay or disability. A meta-analysis found that 42% of children with delay or disability had a secure attachment compared to 62% from a population sample. Best practice in early intervention recommends the use of a key worker or a primary service provider model, where one professional engages with the child and family holistically in their natural environments. Given the close relationship between the service provider and the parent, they're therefore well positioned to improve the attachment security of infants and children with delay or disability. There's emerging evidence, however, that many early intervention professionals have not received training in early attachment and as such are not equipped to effectively support secure parent-child attachment. This study explored how early intervention professionals could support the development of secure attachment in children with developmental delay or disability. Importantly, this study aimed to explore possibilities within the context of best practice in early childhood intervention in Australia. The researchers used constructivist grounded theory methodology for this study, as little is known of the research area. This exploratory form of research aims to develop a theory that is grounded in real-world data. This methodology involves the participants in co-constructing the theory by tapping into their knowledge and experience to direct data collection and analysis. In-depth, semi-structured interviews were conducted with 3 parents and 18 professionals, who included early childhood special educators, a maternal and child health nurse, a mothercraft nurse, occupational therapists, psychologists, social workers, and speech pathologists. The professionals could also be grouped according to experience in the field. They included 5 early intervention professionals, 4 intervention experts that had experience with interventions and tools targeting parent-child relationships, 4 non-early intervention professionals who had an attachment focus, and 5 with expertise in various aspects of child development. The research commenced with initial interviews with the 5 early intervention professionals from an organisation that used a key worker approach and provided training in attachment. This was to enhance the likelihood of capturing effective practices. Data from these initial interviews was coded to identify major themes and guide further sampling from the remaining participants. Most of the codes were identified in the first 5 interviews, with theoretical saturation occurring by the 13th interview. That is, there were no new codes. Focus coding resulted in linking of codes to conceptual categories. The first author then used diagramming and memoing to analyse the relationships between the categories, identify the primary themes, select the core category, and create the proposed framework. 7 conceptual categories were selected: importance, challenges, the system, the key worker, assessment, strategies, and outcomes. And 2 dominant themes were identified: the quality of the relationship between the early childhood professional and parent was found to be one of the key elements in effectively supporting the development of secure parent-child attachment. The other main theme, self-regulation, underpinned the importance and challenges of attachment for children with developmental disability and how to improve their attachment security. An attachment-focused early childhood intervention framework is proposed, and you can see it pictured here. The researchers identified 9 key strategies that included talking about attachment with parents. This involves helping parents understand what attachment is and why it's important, and how to identify their own child's attachment behaviours. Supporting parent-child communication. For example, supporting parents to tune into their child's attention, follow their lead, and go at their child's pace. Helping the parent co-regulate involves strategies such as building the ability of the parent to notice, name, and regulate their own emotions in order to enhance their capacity to co-regulate their child and build the child's capacity for self-regulation. This is the foundation of the Tuning Into Kids program, which teaches parents to emotion coach their children by noticing emotion, connecting with the child, naming and reflecting the emotion, empathising, and if necessary, solving problems. Using video to reflect was another strategy. For example, showing the parent short clips of film of the parent positively interacting with their child. This is used to reflect together about what was working well and to encourage further use of positive interactions. Focusing on positives is a strategy familiar to many early intervention professionals who use a strength-based approach in their work with families. Creating enjoyable parent-child engagement is a strategy all about playing games and having fun, using rhymes and songs, telling stories, and doing enjoyable things together. This strategy is used in formal programs such as Make the Connection and Parent-Child Mother Goose, as well as in individual work with families. Using touch is a strategy commonly used by parents to soothe their child by cuddling, rocking, massage, and gentle touch in rhymes and songs. Sensory or self-regulation strategies were identified as strategies used to help children manage sensory dysregulation to improve their child's behaviour, reduce parental stress, and increase their confidence. And lastly, parental mental health was highlighted as an important impediment to secure attachment, and early intervention professionals talked about the importance of talking to parents about their feelings, as well as referring them into counselling services where appropriate. Interviews from this study emphasised the importance of secure attachment in children with developmental delay. Data also revealed that these children need considerable assistance, encouragement, and a repetition to learn, substantial assistance in developing self-regulation, and they have a sizable likelihood of experiencing abuse and neglect. The conceptual framework provides clarity and guidance for early intervention professionals across a range of disciplines on how to support parent-child attachment. The research affirms the current best practice approach in early intervention and adds the focus of attachment security to this. With more early intervention professionals having access to training using this conceptual framework, the outcomes of intervention can be enhanced. This will ultimately enhance the positive outcomes for children with developmental delay or disability, linked to their development, well-being, and overall participation. There are a range of ways you could dig deeper into this topic. Remind yourself of the Early Childhood Intervention Best Practice Guidelines. Read the associated literature on attachment. A good starting point is the 2023 systematic review by Stacey Alexander and her colleagues. You could investigate the parent coaching literature, such as Dathan Rush and Melissa Sheldon's work on the coach approach. You could consider assessment tools such as the Piccolo or Parenting Interactions with Children checklist of observation linked to outcomes. And evidence-based parenting programs such as Make the Connection, Parent Child Mother Goose, and Tuning Into Kids. And finally, you can access the Precis webinar by Dr. Stacey Alexander on our website. All three researchers are from La Trobe University in Melbourne. You can contact Stacey at drstacelalexander@outlook.com. Thank you for listening to this research snapshot. You'll find more snapshots relevant to your daily work on the Precis website.